Zambia Blog Talk Radio.
Hello, Zambian diaspora businesses. Do you want to connect with your community back home, right on ZBTR TV? I'm here from Vibeforge AI Studios, Tilfeus, where we're crafting faith-fused media with AI magic. From AI music video production to powerful AI image creation and even music composition. We've got everything you need to make your advertising truly resonate on ZBTR TV. If you're ready to make an impact, let's create something extraordinary together. Your vision, AI powered. Connect with Vibeforge AI Studios today.
Good morning and welcome to Zambia Blog Talk Radio TV. My name's Yereka Mhango, and I'm a moderator on this mental health panel presented to you by Global Alliance for Zambian Healthcare Professionals. And my co-host here is Ali. He'll be able to introduce himself shortly. I am not new to Zambia Blog Talk Radio. Actually, I haven't been on this show for a while, maybe over 2 years. So I'm happy to be back. This time I'm back under the Global Alliance of Zambia Healthcare Professionals, and we'll be sharing several shows with you on different topics. And today is the first show that we're presenting, which is on mental health. So I'll pass it on to my co-host, Ali, to introduce himself.
Good morning, and thank you again, Yereka. You look brilliant this morning. Over there, I believe in the Big Apple in New York, right?
Yes, it is.
Awesome. Well, so we'll make this show an exciting show this morning. Obviously, I'm happy. It's not my first rodeo here on the Blog Talk Radio. I've been a prominent feature discussing a number of subjects or topics. And so today, as my co-host Yereka mentioned here, I represent a unique set of individuals that are truly interested in this topic on mental health. Over on the West Coast here in the Bay Area, around the San Francisco area, my name's again Ali Joseph Mwene, and I'll be a co-host. I'm also a member of the Gazhp on the finance side, the treasury side, and the legal side of the organization. Thank you again, and we welcome you all to this exciting show this morning. Over to you, Yerek.
Thank you for that. So before we bring our speakers, we would like to bring Dr. John, who is the chairman of the board of the Zambian Healthcare Professionals in the diaspora. So welcome, Dr. John, and please introduce yourself.
Yes, thank you so much, Yereka. Yeah, I'm John Msonda. I'm privileged to be the chair of Gazhp, and I'm proud to say I'm working with the able men and women who are up to the cause, and this is evident even from the way this event is taking place. Yeah, we've been in existence for about 5 years, and we've had a lot of successes on the way. And even myself, I've known the Zambia Block Radio for some time. There was an event 2 years ago where I was invited to come over to, but I couldn't make it. So it's not the first time that I'm participating or listening to the radio. So I'm based in Johannesburg with a lot of affiliations in Zambia. I am a member there of the Association of Family Physicians of Zambia because I'm actually a practicing family physician, and also assist in several other aspects in terms of administration. Yeah, so I'm happy that I join a group of experts, and I'll share my own experiences from the family medicine point of view, where about a third of what we do is actually in the realm of mental health. And not only that, we work along with the psychiatrists. So this is a great place to be. Thank you.
Thank you so much, Dr. John. I think at this point, we're going to invite our speakers who are on the panel, and they will be introducing themselves. We are privileged to have experts from different sectors of the Zambian healthcare industry to drive this conversation and just give us some insights on what's going on in Zambia, and also give us some guidance on what we should be focusing on. Welcome to the show.
Thank you.
Thank you.
Thank you. So I'll pass it on to my co-host Ali, who will be driving the conversation and will be chiming in as needed. Thanks.
Excellent. Thank you, Reka, and I'm glad here. Let me see. Make sure I can see John here. John, if you can move a little bit closer to camera to reduce the roof. Excellent. So maybe from my left here, let me go with Dr. Tembo. If you can please introduce yourself and just tell us where you are and sort of your specialty, high level. And we're glad to have you again in the house. Over to you, Dr. Tembo.
Thank you very much, Ali. So my name is Tandiwe Tembo. I'm a psychiatrist by profession. Working at Chainama Hills Hospital, which is our tertiary mental health institution here in Zambia, where we are managing individuals who have mental health disorders, streaming from your common disorders like your depression all the way through to substance use and the related disorders. Also involved in the clinical research, coordinating clinical activities within the institution, as well as teaching of both undergraduate and postgraduate students, as well as curriculum development. So in summary, that's what I would say about myself. Thank you very much, Ali.
Excellent. Thank you. We just love what you guys do. Professionals truly moving the wheels of healthcare in our country. And thank you again, Dr. Tembo, for what you do. Let me move over to my next right, Dr. Francesca Walia. Please tell us where you are and what you've been doing, and please share your wonderful experience to the audience and to the listeners.
Thank you, Ali, and thank you all those who've come in to listen to us discuss around mental health. I'm a psychiatrist. I'm also based at Chainama. And other than practicing clinical psychiatry, I also am an academician teaching in the field, both postgraduate and undergraduate students. And I am passionate about helping people live their best life. And I'm also privileged to sit in a certain capacity where I coordinate national mental health programming under the Ministry of Health. Yeah, I think that would be me in a nutshell. Thank you.
Awesome. Thank you. Last but not the least, here on my far right here, we have an able professor here, Dr. Professor Jedrin. Please tell us where you are and what's going on in your world there. Please share with the audience. We're interested to know the things you're doing and your excellent experience in this industry. Over to you,
Okay.
sir.
Thank you very much. So my name is, you can see on the screen now, Professor Jedrin Ngongo. I'm a Zambian who is currently practicing in Ontario, Canada. I am an associate professor at Western University, which is one of the universities here in Ontario, where I work in the I'm involved in the training of medical students and specialists, and I'm also involved on the administrative side as well. Um, and until recently, I was the medical director for Victoria Hospital. Victoria Hospital is one of our, I think it's the fourth largest hospital in Canada in terms of how many patients we see and stuff. And I was until recently medical director for about 5 years until I stepped down because of competing demands on my time. And my passion really is being a doctor or a psychiatrist to patients. So I work as a consultant psychiatrist in London, Ontario. I deal mostly with adults uh, from the age group of 18 to 65 with all sorts of conditions, which my colleagues have mentioned, depression, anxiety, substance use, etc., etc. And I'm very happy for and grateful that I've been invited to participate. I want to thank um, Gazhp for arranging this, and I want also to thank Zambia Block Radio for giving us this opportunity to just talk about mental health.
Thank you again, Professor Jedrin. We are excited to have you in the house. We are excited. This is going to be a phenomenal and great show. And again, not forgetting Dr. John Musonda here, who earlier introduced himself. Welcome, Dr. John Musonda here. We're glad to have you in the house. So I'll move over to my co-host Yareka. So Yareka, what do you have? What do you have in the house? Do we kickstart the show now, since we have
Sure,
introduced
sure.
ourselves? Yeah,
Yes. And I just wanted to acknowledge again Dr. Francisca. We had met in Lusaka. We had hosted an event. And when we invited her, she was quick to jump and come and attend the event and talk to the youth. So I'm very happy that we can connect again here on Zambia Block Talk Radio.
that's
Well,
awesome. And just in addition to that, Yareka, Professor Jedrin, by the way, I love that name, Jedrin. It's a great name.
Thank you.
Probably the first Jedrin I've heard today, right? I've been tripping to Canada, so hopefully in the next couple of weeks, and we can connect and just meet in person. I think that would be great.
Oh, that
Over
would be
to you.
wonderful. Yeah.
Over to you,
sure.
Yareka. Yeah.
Yeah, so we just, again, I think in our earlier discussion, we said we really want to hear from you as clinicians. Ali and I are accountants, but we're CFOs working in healthcare organizations. I
Yeah.
work for a nonprofit organization that has been providing substance use treatment and mental health services to New Yorkers in the past 60 something years. So I'm interested in seeing how what we're doing in Zambia aligns with what they're doing here, or complements each other. So I will just go ahead and ask the first question around stigma. So how does stigma around mental health manifest in the Zambian communities, and what can be done to reduce it? This question will be for Dr. Francisca, since you're in the community most.
Yeah, so stigma is present in the community around mental health. And I think a good number of it is around various myths. Understanding the culture, the Zambian culture, there's the religious aspect, there's the traditional aspect, which sometimes are able to guide people's beliefs of certain presentations that they cannot maybe understand or explain. So some of these presentations may be assumed to be caused by demons or other traditional aspects, like maybe someone has been bewitched,
Mm,
or maybe because someone did something wrong, ancestral aspects or punishments. But other than that, I think a larger aspect, I think in general, is because there's a lack of understanding of what mental health is. I think if a number of our people actually appreciated what mental health is, or what mental illness is, and how it presents, I think it would really reduce the amount of stigma around mental health. And we see a number of families concealing when they have an individual who's presenting with a mental illness. And further, there's a reluctance to come for health support or to present to the health facilities. Hence, you'll find certain severe presentations of certain mental health conditions. And before they present to the hospital, they'll seek alternative treatment and support. I think some research has actually shown over about 70% of people who first seek traditional healing or other alternative support before they actually present to the health facility. But I believe with the awareness we've done in the recent 3 to 5 years, we should have seen a reduction. I think there might be need for research around that area again. So it's a complex issue, but I think in general, I think it's due to the lack of understanding of what mental illness is.
Thank you for that. So maybe just, is there anyone else who'd like to add on to that? Dr. Jedrin or Dr. Tandiwe, please feel free to come in as we ask the questions.
So I just wanted to say that I think Dr. Francisca has taken the words out of my mouth. I think she's really hit the nail on the head, and I think really stigma is not only in the Zambian context. I have had the privilege to work in England for 10 years before I moved to Canada. I've been here now almost 15 years. And I started my journey from Chinama Hospital, where I worked for 2 years before moving out of the country. And honestly, the stigma against mental health is everywhere. It's not just in the Zambian context, it's in the British context, the Canadian context. It's rooted in ignorance, as Dr. Francisca has said. It's a belief that people always separate other physical, excuse me, other physical health conditions from mental health conditions. People are less shy or are willing to admit that, oh, I have high blood pressure, or my doctor saw me and I think I'm anemic. They easily say those things. But if it's a mental health condition, people always don't want, because they think mental health is different. They don't think it's a medical condition, but it's very much a medical condition, like all the other medical conditions that we treat as doctors. So it's that ignorance that people have that leads them to shy away from seeking help or admitting that they have a mental health condition. And the wrong beliefs that people have, which again, Dr. Francisca highlighted, where people think that a mental health condition is like demons, or is I've been bewitched, or it's or I'm weak-minded, or so there's all these wrong beliefs. And one of the things that I've heard, especially when I was at China, is that people believe that there is no cure. Once you have a mental health condition, that's it. It's a lifelong condition. So it's this ignorance which hopefully we who are involved in this area are helping to educate the public and to realize that there is help, and then consequently we'll see less of the stigma that we've seen.
Do we know if there are any programs, activities that, for example, Chinama Hospital has implemented in the communities to help them understand about the different diseases around mental health, and to help them also understand that there's a cure for most of them? So do we have these activities, and where are they? How are they communicated in the community? Because I don't really hear much about Chinama. I do. All I could hear in the past is Chinama Hospital, and there's a stigma around going to Chinama, so it's always used in that context, like a stigma context. But what else is there to encourage people to go there?
So yes, we do have a number of activities that we do within the communities, and most of the time we are not doing it as Chinama Hospital alone. We are working with other organizations that are operating in the community. At the same time, we are also working with the lower facilities, giving technical support to the smaller facilities that are more within the communities. And this helps us actually to avoid unnecessary referrals of patients to Chinama, which is a tertiary hospital. So we are working more with the facilities and other organizations that are based in the community. For example, what we do on a yearly basis in commemoration of World Mental Health Day. We have satellite activities starting from September, when we commemorate the World Suicide uh, Prevention, all the way through to World Mental Health Day. During that period, we have awareness activities in the communities, satellite activities, open places like markets, where we do a lot of awareness in terms of using drama, traditional dance troupes, and such activities. All this is in an effort to raise awareness in the community. But we also do know that as a tertiary facility, we can't be everywhere. And that's why we like leveraging on the activities that are based, the institutions that are based in the communities, and working with our other organizations as stakeholders in this fight.
Thank you for that.
And allow me to just add to what Dr. Tembo has just mentioned. We Chinama as well does a lot of media programming, both on television and on radio, and on various podcasts. And just like we are here today,
Mhm.
Chinama, I think, provides a lot of technical support, technical experts who create awareness around mental health, talking about mental health in general, various mental health conditions on TV and radio,
Awesome.
hence reaching a larger aspect of community as well and different aspects of community.
That's a great point you mentioned it there, Dr. Francisca. I think this is a great segue to a very important question here, because we've addressed the stigma, but I see a lot of ignorance when we talk about mental health, and I like to bring in Dr. Tembo here, Dr. Tandiwe Tembo, and Dr. John here. What are some of the uh, challenges, mental health challenges in Zambia for the youth and adolescents, and maybe let's address the root cause. What are some of the challenges? Because I think that my partner here, Reka, we work for these large institutions, and so we see dignity placed on the individuals that are in this situation, which apparently in Zambia we don't. I remember growing up, would see a mental health patient behind our house collecting food from a waste garbage trash, and that stigma, and the street kids in the streets would be yelling, "Ichipuba, this one is mad, Dibali Pena," and that makes me very sad because we have eroded that dignity uh, on the mental health patients. And I think that I like us to address the root cause and how we can sort of a high level provide solutions to that. Dr. John, over to you. And then we'll have Dr. Tandiwe here, respond to this question as well. Dr. John.
Yeah, no, thank you so much, Ali. Yeah, I thought the issue of stigma was handled very competently, and
Yeah.
it's mental health we are talking about, but also to remember that the stigma is a global phenomenon, and that it's not just for mental, as I think they already alluded to. It can be physical, can be social. There's those kind of negative perception we have which discriminates these people, and as a result, they don't come out. And even families would rather handle these issues within themselves instead of seeking expert help. So stigma is huge, huge, huge. Then when we come to
Yeah.
the issues of the challenges themselves we have in terms of mental health, when we look at the adolescents and the young adults, for example, in Zambia, um, it it is a broad area. It's a broad area in that the family is the smallest unit which makes a community, and from there you have a lot of factors around the family. So the environment itself, where these people are grown or where they are found, issues around what is happening within the family itself, and There could be a family which is dysfunctional, which could lead to all these problems. And then as children grow up also, especially we are seeing that in terms of substance abuse disorders and so on, they can be as areas, they start even as early as 10 or 13, the commonly reported 13 to 15, they're already fully hooked on substance. And the control thereof from the parental care itself becomes a big issue, from the home where they are coming from, the supervision. And if they are going to school, they've got this peer pressure from friends. The choice of friends they make within the community, even at school, makes them have access to some of these substances. And then you also have, people have spoken about a genetic, apart from environmental, a genetic kind of component. And what we do in family medicine is that if a patient comes, it's really the entrance to that family, and we do assess the whole family, and you get a much better picture about what could be going on. So that when you fix these problems, it's not just an individual you are targeting, you need to treat the whole family. So it therefore means that you get your diagnosis right, and then you go into the the psychological aspects, and then you see how you can support them from the social point of view. So if you are dealing with an adolescent or a young adult, the approach is such that they will need a lot of support from, firstly, the family itself, and then from the community, the school where they go, to be able to have access to the psychologists and the other resources within the community, so that it's a multidisciplinary kind of approach. It's not one single family which is going to handle this. And we should also remember that the climate in the country, also around the policy, around the resources, is also very important. And if that is lacking, then it becomes a big problem. For example, if you look at homelessness in Lusaka, you have about 30,000 children who are homeless, and of which a quarter of those are already hooked on the substance. It becomes a tall order, to try and that. So that this problem which you've given us is a huge one, and it needs not just the government, but also the community and the non-government organization to put our act together. But most importantly, we probably need a great leadership, because once we've got a great leadership, all these can unlock themselves and the best can come out. Yeah, so the causes are multifactorial and may not be pinpointed. The presence of a psychiatric condition itself could lead to substance abuse, and substance abuse could lead you to more psychiatric illnesses. So it's something which we need to consider holistically. I think I'll end there for now. My colleagues can just add on that from their expertise. Thank you.
Yeah, and so you bring up excellent discussion points here, and let me allow Dr. Tandiwe, please chime in and give us your take, the common mental health challenges in Zambia, sort of the root cause, and maybe provide what you think could be solutions to obviously tackle this big issue that we have.
Thank you very much, Ali. And I must say that Dr. Msonda has really outlined very well in terms of the fact that it tends to be multifactorial. There are so many factors. You can't point at one single thing. But I think allow me to talk about the fact that one of the things, or one of the areas where there seems to be an issue, is starting from the issue of parenting. How are we parenting? I think I remember when we were growing up, the statement that it takes a village to raise a child is something that is very important. But I think that we have seen a bit of a change in the way children are being raised nowadays, in terms of the current generation compared to previous generation, where it's more dependent on the individual family to raise a child. And so if you have busy parents and you have parents who are not available as much as you would want them to be. There's that aspect. And then them being adolescents, you know that adolescents tend to gravitate more towards their peers. So then they will have more influence from the peers than from the parental setup, as you would expect. So then you start seeing them getting into the issues of substances and the like. So that is one aspect. Apart from that, when you look at it from the issue of substances, it's the ease of accessibility of the substances in some of these communities. You find there are places where they are selling alcohol here and there, almost at the neighbor to where the child is staying, so they can easily access some of these substances. Then, of course, the peer pressure from school, the genetic predisposition, which is there. So we are seeing, for example, from a Chainama hospital point of view, we are seeing a lot of cases of substance. In the youths and adolescents, that's the number one condition that we are seeing. And then, of course, family problems leading to depression. We are seeing children with depression presenting with a lot of suicidal ideation as the reason why they are being brought to the facility. And so in essence, what we are looking at when we have this adolescent or the youth, we are trying to identify any possible risks in this child or in this adolescent, and then trying to address these various risks. A holistic approach. Yes, you might give them education, but also there's the psychology of the environment where the child is coming from, the home where they're coming from, the social setting where they're coming from. All these issues need to be addressed if we are to manage these conditions holistically.
Excellent. Well, I can almost clap for you guys. I mean, the levels of intellect that you bring on this show is amazing. My partner, over to you.
Sure. So I think you've mentioned all these different environments, which could be the home, the school, where kids could present with different issues. So, how would you, or what signs should parents, teachers, community leaders should be looking out for to identify mental health struggles among the youth? And how do we create an environment where the youth are free to ask questions, they're free to talk about their struggles, and without the stigma that we already mentioned? Because often, if a child, especially the 13-year-old, 10-year-old, most families would just say, oh, this child is difficult, or this child is like that. So how do we create an environment where parents are now able to sit down and talk to their kids about substance use or mental health issues without disregarding how they're feeling?
Okay, so I think as the child is growing up, there are times when the children start asking the difficult or the uncomfortable questions. And I think we need to look at that as an opportunity to use to teach the children. And if we are able to encourage that, I think even when they reach certain ages where they start experiencing certain struggles, it becomes easy for them to ask because we have created that environment of openness. Now, when you look at where we're coming from culturally, there are certain things that parents don't want to talk about. And so it becomes very difficult. We don't have that open environment to engage with the youths. And so you find that they would rather get information from their fellow peers who equally do not have the right information. And so creating those spaces where children are able to express themselves is very important. And that's why in some facilities, you will find the adolescent-friendly spaces and where you have peer educators, because they are more able to express themselves to their peers. So peer educators, adolescent-friendly spaces, those are things that will encourage the youths to come out and talk about their struggles. And some of the signs and or symptoms that you might see in these children, for example, if you notice a child who is very outgoing, loves to be with the friends, and then all of a sudden they are keeping to themselves, they are appearing very shy, they are too quiet. These should be signs for us to get consent in terms of what is going on. Sometimes it's something like poor performance at school. A child who's been performing very well, all of a sudden they start performing poorly. That is a sign that something could be wrong, something could be going on. And also any unusual behavior out of the ordinary of what we know our children to be, these adolescents and youths, how we know their behavior to be a sort of deviation from what we are used to, should trigger us to get consent. Sometimes it's reports from school. The children spend a lot of time at school, and then the parents give this report about a certain behavior that they have observed. So those need to be entry points for us to try and find out what is really going on. Because another thing of note is, particularly in adolescents, the mental health conditions will not look like the way they look like in an adult. So it's any deviation from the usual behavior should cause concern for us to want to find out what is going on with these children. I think I'll end there to allow my other colleagues to chip in.
Sure.
Thank you, thank you. No, let me come in. Yes, no, you've done very well. That's a good explanation. And you also find, for example, in the community that there if you've lived in communities, you may even be maybe about the situations where you've seen this and we thought it was normal. Where certain teenagers or adolescents, they just end up in crime. Crime and violence. Sexual risk behaviors. That kind of situation. Then it will just almost all the time to give you an indication that they may be under the influence of some substance in one way or the other. In one study, they said in Southern Africa, in Sahara, the adolescents and the young adults or the youth, up to 42% did confirm that they were actually abusing or under substance use disorder. And in Southern Africa alone, it's 37%. And if you look at all these studies, you find that most of them will give you a very high prevalence, and it's of great concern because the resources are not following those kind of high prevalences we are seeing. Yeah, so it's really the duty in terms of the community as well as the families to be on alert and try to identify these issues. Then as the schools and the teachers, they also need to have programs which assist that these youths can quickly be detected or quickly be assisted, and something which helps them to not to fall into that trap. Yeah, so it's the whole program must be supported by policy, maybe the stricter government policy in terms of access. You cannot have a place selling alcohol within the compound where children are playing around. There should be restricted areas of these children to access alcohol as well as to access even over-the-counter drugs. In Zambia, one thing you notice is that you go to a pharmacy or chemist, and you can buy anything over the counter, no prescription, and it is normal, and it's not like it's a secret. Everybody knows it happens. They sell medications, antibiotics, and so on in markets. So you see the role of the government to come in and have a strict policy and monitor and ensure that they monitor and evaluate that these things are correctly adhered to. Yeah, so that is the situation at the moment, as far as I can see. Thank you.
Yes, I think I'd agree, Dr. Msonda, about the schools providing an environment for kids to seek counsel. Here, I've seen programs where the schools would ask for a counselor to be on site. And whenever a kid presents with mental health issues or substance use, they'll call a counselor to talk to the kid. But I think the schools have to be intentional. They have to seek support for institutions like Chinama for help, because I don't believe we even here that they have these counselors in every school. I think they have to ask for the from different organizations that have counselors to support them. So I think having that in the schools would be helpful. Another intervention is having clubs where they talk about substance use within the schools, and just having like peer support from their friends has also seems to be working for a lot of programs for adolescents. So we are at 40 minutes into the show. So we'll take a 2-minute
Mhm.
break and
So,
we'll be
partner,
back with more questions.
maybe before we dive into our quick commercial here, I just wanted to echo on what Dr. Musonda said here, that policy is key in driving change and mindset, because police touches on several several levels or levels of behavior. That includes how we do business. Now, police can obviously regulate business, right? And that's very important because you and I, when we're in Zambia, partner, we spend a lot of time really interacting and talking to the youths on the streets. I sometimes spend my time in Soweto there, and you see the youth that are drunk, and here in the United States, it's called substance use, right? Disorder. They drink things like junta, to jiri jiri, all these things. And by the way, we have a lot of feedback from the listeners, the audience that are really listening to us, and they're giving us these ideas. And I'm glad that our our, our panel here is really hitting on these points on policy to regulate business and how we can see a visibility of leadership in people's lives. So thank you again. I thought I'd point that out because this is a great show and we have a lot of people that are listening and they're giving us feedback. So, okay, over to you, partner.
Sure, thank you very much. So we'll take a 2-minute break and we'll be back with more questions and feedback from our panelists. Thank you.
Thank you.
Hey Zambia, are you ready to kickstart your Saturdays with insightful conversations, unmissable guests, and all the trending topics you need to know? Then you have to tune into the ZBTR TV show. It's an electrifying show every single Saturday morning at 9 a.m. Central Standard Time. From current affairs to lifestyle, entertainment, and everything in between, we're your go-to source for vibrant discussions that matter to you. Mark your calendars. Every Saturday, 9 a.m. CST. Join the ZBTR TVS show live stream and be part of something amazing. And while you're at it, don't forget to subscribe to our channel. Most of our viewers are not subscribed, and we really want you to be part of our growing community. Also, give us a follow on our social media platforms to stay updated throughout the week.
Welcome back to the show. We'll continue our conversation here on mental health, challenges that the youth and adolescents face in Zambia. But we're generalizing the conversation. It's not just Zambia, even here in the USA, because Global Alliance of Zambian Healthcare Professionals, most of the professionals are out in the diaspora, and we just want to share information, hear from those who are on the ground, and also hear from those who are in the diaspora. And prior to our break, we were just touching on policy. So I was just wondering if my co-host wanted to expand more on that. So over to you, Ali.
Thank you, my co-host Erika. Maybe we can take a minute here and allow our background technicians here, Nathan. I think we indicated that we had some questions from the audience.
Sure.
Do we have those available? And then we can allow the panel to chime in and see if we can get some responses. Nathan. Okay, our first question is coming from Kasonde Musoma. I know him as Professor Musoma, he's a colleague. So the question to the panel is, and I'd like to throw this to Dr. Francesca. And again, we can obviously as a panel weigh in. The question is, would it be fair to say that hyper Pentecostalism, that's a great word, and cultural inclinations are a core impediment? And partner, this would be a segue to the next question, right? But let's allow
Sure.
Dr. Tandewe chime in. Thank you again, Kasonde, for that question. Dr. Tandewe.
Okay. So coming from someone who is working in a facility where we're seeing these patients, I will tell you that by the time they are coming to us, they would have had symptoms for a long time. They have gone to some pastor somewhere who has admitted them, or they've gone to the mountains and stayed there. And then they have gone to the traditional healers and they've been admitted by the traditional healer. And then by the time they are coming, it would have been a year from the time the symptoms started. So it is an impediment in terms of seeking, in terms of health seeking behavior. It delays presentation to the healthcare facility. And also because it comes with, from the Pentecostal realm, allow me to use that word, it comes with, there's something wrong you did, you have demons, you are demon possessed. So there's that aspect. Whereas from the cultural aspect, it's also you've been bewitched, as Dr. Francisca Wale had explained earlier. So it's those beliefs and the actions stemming from those beliefs then leading to a delay in access to service. So yes, they do act as an impediment, but whether I would say core impediment is where the issue is. I wouldn't say they are a core impediment, but I would say that they do act as an impediment to access to care.
Absolutely. Dr. Francisco, obviously, not that I'm asking a question to you that you're Pentecostal, but see if you can weigh in on this. What's your take?
So I think from research and from my experience as well, anecdotal in practice, I think there are two sides to this coin. So when you look at spiritualism or religion, even research has shown it, that it's actually very protective and good and it's beneficial, and it actually can be a buffer and can be protective to prevent mental illness and for people to build resilience, to be able to manage themselves better and have a better mental health state. And it can be also very protective because for religion, and even I'll speak maybe of Christianity because Zambia is a Christian nation, you find that that will be protective because it gives people hope, right? It helps people to focus on something outside themselves. So I think now where the issue comes in is how this religion is practiced, the perception, the doctrine around it. So if someone follows healthy Christian or biblical principles, they should be protected because it also creates a community where individuals can socialize, can have people who they can reach out to, seek counsel or support, and they can have good relational connection, which is protective. our mental well-being and promote
Mm-hmm.
our well-being. Now, it's when those settings, for lack of a better term, I would say toxic or not healthy, or the doctrines are maybe not following certain biblical principles, which should be good and protective. That's where now religion, or I think what Kasonde was referring to as hyper Pentecostalism, could maybe act as an impediment. But I think currently we've seen a shift in some religious settings, both Christian and non Christian settings, where they're actually able to invite us specialists or experts in mental health to talk around mental health to their congregation. I've seen a number of churches now coming up with programs where they're able to offer counseling and support and safe spaces for individuals that are going through various tragedies or experiences. So this aspect, I think it depends. Of course, there's some dysfunctional presentations of Pentecostalism, which could be unhealthy if they are maybe putting undue pressure or stress on individuals who are attending that church or religious setup, or if they're guiding people in such a way that they shouldn't reach out for any form of support outside the church. So I think now those are some of the settings that could maybe be an impediment. But from my experience, for individuals who create a healthy network within their religious setting or Christian setting, even Pentecostal evangelical setups, they actually thrive and they have potential to thrive. Also, on the cultural aspect, yes, there could be some cultural aspects like maybe approaching traditional leaders when things are not making sense, when they're not seeing improvement, but they're still delaying and they move from one traditional healer to another instead of bringing them to the hospital. But when we look at other aspects of our culture, like earlier on how Dr. Tembo spoke of community, a community raising a child, right? Ubuntu-ness, everyone caring about their neighbor. If we look at that other angle of culture, especially the African culture or the Zambian culture, where we are welcoming, we are friendly, we care for the next person, the neighbor, that alone now can be protective when it comes to mental well-being and building resilience, because you have people to talk to, you have a lot of social networks to engage with. Though I will say a lot of the culture in Zambia is also changing, especially in urban areas, right? It's becoming also westernized. We have offenses, busy lives, so maybe we have limited time to actually have this social aspect of our lives, which can be protective. But if we look at that aspect of our Zambian culture, that can actually promote well-being, whereby you're deliberate to have time with family. You have deliberate to, over the weekend or on a Sunday, meet with people who you share core beliefs or ideas, you socialize, you relax. Those can actually be, can promote mental well-being. So I think there are two sides to the coin. And I think it's about guiding the public to understand how to harness either their Christianity, Pentecostal aspect, or their cultural aspects to work for them to promote their well-being and to help them identify what traits could be harmful to them.
Excellent.
Thank you.
Professor, I think that in the interest of time, we have a number of questions here, and I'm getting worried here, partner, with time. But, you know, Professor has been really yearning to like almost explode there. I want us to engage him on this same topic, but we have a number of questions here. So here's what we're going to do. Professor, you're going to sort of give us sort of your points on what the questions that Dr. Francisco was talking about. And then you pick up on this next question. Let me read it. It says, how accessible is mental health treatment to the public outside of inpatient psychiatric treatment? So, Professor, wrap it up there and let's move on here. And then my co-host will pick it up from there.
No, thank you very much. So, you know, I want us to bring this concept of mental health, bring it home and make it very relevant to many people. Because sometimes when people talk about mental health, they have these big concepts that you're talking about, schizophrenia, you're talking about personality, bipolar disorder, borderline personality disorder, etc., etc. But mental health is a very broad term, and I want to make it very relevant because mental health is a range of conditions from things like feeling inferior, feeling lacking confidence, and having self-doubt, having anxiety, sadness, depression, to the whole range where we get addictions and psychosis, etc., etc. It's a whole range of conditions. Some people have just a feeling of insecurity, a feeling of anxiety, and therefore they can't perform. So we have to include all those people in terms of how we discuss mental health, and not only focus on the biggies, which are important, but they affect very few people, if we are honest. I mean, something like schizophrenia, the incidence rates are about 1% of the population. So we have to include the other people who are also suffering with mental health conditions as well, which may not be described as the big things. And moving on to the question of spirituality or hyper-Pentecostalism, as has been stated, I do agree with what Dr. Francisca has said. So my patients, one of the things, the challenges we have in mental health is for young people specifically, is lack of support. Okay, young people don't have the necessary supports, and even when the supports are available, young people don't know how to access these supports. So what I tell young people, I do speak to young people as high schools and undergraduate students about mental health. And one of the things I tell young people is to remember and think about your supports. And I think somebody on the panel did talk about peers, like talking to your peers. So your peers can be a support, but remember your peers are probably as young as you are, probably facing the same challenges. They don't have the life experiences that one needs to be able to help another person. So when we're talking about supports, the first thing I tell my patients, or when I'm talking to young people at high schools and universities, is remember, family, don't forget about family. I mean, if you're having issues, remember, you have to start with your family. You'll be amazed how much support they're able to offer you. I'm not saying every family is the same, but that's an important starting point. Start with your family. Talk to somebody in your family. If you can't speak to your dad or your mom, because, sometimes it's difficult, ring your auntie, ring your uncle, that's all supports. And then it brings in the issue of religion, spirituality, etc., which is discussed previously. The church can be a source of support. I mean, talk to your youth pastor, talk to your pastor. That's the way of accessing support, depending on the issue that you are confronted with. You can talk to somebody at church, talk to your teachers, talk to somebody at school. That's all a network of support. And depending on what you're confronted with, then you can escalate to counselors, psychologists, psychiatrists. But don't forget these other support networks that people tend to forget when they're confronted with a mental health challenge. And yes, one of the things that I've highlighted is support. Sometimes this support looks very different. Sometimes it's at the church. And I agree entirely that people who have a connection, a community connection, like at church, or they attend some club and they have some sort of support network, that does definitely help mental health. It does help mental health. But what we have to avoid and encourage people is that, you can pray as much as you want and you can pray all the time. That's all well and good. But where it becomes a problem is where people would rather just pray instead of seek help or professional help, or would prevent other people from seeking help because they should pray, or as we've heard, go to the mountain. Then it becomes a problem. But if people are praying, but they are not delaying seeking professional help, I think that's all well and good. I think there's a role for everyone to be involved to help young people with their mental health conditions.
I have a question before we go to the next question in the audience. How do the young people overcome peer pressure, especially around substance use, mental health? I mean, how do they overcome the peer pressure? How do they cope? What are some of the coping mechanisms or strategies would you share with them?
Maybe I can chime in there and then allow my colleagues to. So one of the things, the challenges that young people face nowadays, I think we had different challenges when we were growing up. We had a sense of community, would go out and play chimpombo and all those things. But the young people now, it's a whole different world where they live. There are challenges that they are facing unprecedented in the history of our generation. So one of the things that young people don't realize is one of the things that we haven't talked about is social media. Okay. So social media has a good side and a bad side. Okay, and we are right now live on social media. So it's got good sides, but what we're saying with young people is that it takes away all their time. Their time is just dedicated to social media. They are having a shower, the phone is on somewhere nearby. They can see who's posting whatever, and people go out, they're on the toilet seat, sorry to say that, but they're on social media constantly. And what this does, it robs you of other things that may be important for your mental health because there's no time to think. Young people are not dedicating any time to sit down and think and reflect and strategize because all their time is taken over by social media. And what social media does, it creates this illusion, okay, where you think everybody else is better than you, everybody else is doing this and that, everybody else is achieving this and that. And there's some truth to it that most of it is just fake on social media. And then you begin to compare yourself to the people on social media, and you begin to feel insecure, to be anxious, to have worries. And this can lead to other things which we've talked about, like anxiety disorder, depression, addictions, because you're comparing yourself to what you're seeing on social media. So speaking specifically to having time, investing your time in things that can help your mental health. This is what I encourage young people to do. Invest your time in things that can help you, especially with your mental health. One thing, instead of social media 24/7. I think you should find time to watch self-help videos, listen to self-help podcasts on mental health, on different topics that you can invest your time into these things that are going to build you up instead of just seeing what your friends are posting or their friends are doing, etc., etc. So investing your time in having self-help, learning about self-help strategies and things that people are doing that are going to empower you and keep you in a place where you have good mental health. So support and investing in things that are going to help you stay stable or grounded and, be successful.
Thank you for that. We have the next question coming from Zenith, and she's saying, we nurses, social workers, and pastors should work together. Let's train our leaders to recognize signs. Let's stop blaming people for what they can't control. Encourage training programs at churches, clinics, and schools. I think that's been covered already by our speakers. Do we have any other question from the audience? So over to you, my co-host.
Awesome. We've touched on a number of things here, and I think that I can comfortably say that we will need round two or part two of this conversation here. There are so many questions that are coming in. For example, somebody just texted me here that Dr. Francesca, you didn't talk about trauma from domestic violence or loss of parents due to HIV or road accidents. And people are asking these things, is it possible that they lead to mental health issues? I think that people are asking questions because they are going through these situations. Now, I don't know if we have so much time to talk about such, but I think that it leads to a very important segue question here. And maybe before we get to that, anybody wants to chime in on that quickly here? I know we have a few minutes before we wrap our show here, but I think there's room really to exchange our knowledge on this.
Maybe I could comment on the area you just brought out. Indeed, adverse childhood events, different type of traumas or stressful, extreme stressful experiences that individuals experience in their childhood could increase the likelihood of an individual presenting with a mental health issue or even a disorder during the adolescent age or even later in life. So it's one of the risk factors. And I think one thing that we should normalize is when people experience significant events in their lives, like a loss of a loved one, a loss of a large source of income or employment, or if someone experiences trauma, a severe road traffic accident, or a severe surgery procedure that has a huge risk to them possibly losing their life on their lifestyle, or someone gets a diagnosis like HIV or even a non-communicable disease like hypertension or diabetes, we should normalize giving counseling to these individuals at that point where they receive such news or they experience a loss or experience any trauma, whether it's sexual abuse, emotional abuse, physical abuse, before they even present with a mental health issue. So allowing these individuals to deal with the various traumas, losses at that point, and hopefully in a healthy environment, in a systematic way, it could prevent the risk of a mental health issue or disorder later in life. So for family members, community people, even as individuals, when we experience major events or losses or traumas in our life, we should normalize getting some counseling. It can be helpful and protective. Or even divorce. That's another major one for adolescents and children. They might not maybe be having any dysfunction at that particular point, but because it's a major change, it's a major loss in their life, you could also allow them to go for some counseling sessions.
Excellent. And I'll allow Dr. John here to comment, and then I'll get Dr. Tembo, Dr. Tandiwe Tembo. I think this is a very important question. We seem to be getting the same feedback here. People are going through a lot, and let's address these core issues that are truly impacting our people. Dr. John, and then I'll let Dr. Tandiwe weigh in.
Yeah, thank you so much, Ali. Environmental stress situations are a very great concern. In fact, all these conditions which people have cited will lead to post-traumatic stress disorder. And one study in the Southern Africa puts it at 5.8%, prevalence of 5.8%. So it's significant. You know, it's unlike, it's even more significant than schizophrenia the professor was talking about. So it's one area which we need to put resources to, because it's not something you can forget. And there must be a way of for professional healthcare workers. I think it starts from there. The clinicians who see these patients, be it our nurse clinicians or anybody else, should have a high index of approach whereby they should send these patients through counseling. And counseling, those who've done counseling, it's not a once-off affair. Counseling can go on. The minimum could even be 12 weeks, perhaps. So, and we miss that. We miss that in our context because of maybe issues of not having enough counselors or issues of other resources or distance and so on. But we need to start small. Small steps lead to big results. So we need to ensure that we have enough counselors on the ground and people can be referred to counselors who can assist. And if we do it well, then we'll be able to ensure that they don't develop into a full-blown psychiatric kind of situation. So these are the factors which we're having today. You know, it may not even be a divorce, can be loss of employment, things which maybe seem slow to you, minor to you, could be big to another person. And we therefore need to ensure that we put our resources together to address those issues. I think I'll end there. Thank you.
Thank you again. Dr. Tandiwe, chime in here. I saw there was a comment here. I think our background leader here took it out, but I wanted to read that before you chimed in, Dr. Tandiwe. So over to you, Dr. Tandiwe.
Okay.
Oh, here we go. I'm sorry to interrupt
Oh,
here.
okay.
This comment is coming from Juanita Kayombo. Kayombo, in addition to what Dr. John said, as a youth advocate for mental health awareness, I have learned so much to add onto my advocacy journey. So basically, they've taken all their experiences, they've brought them together with them to support and help people that are experiencing this. So, Dr. Tandiwe, talk to us about some of the issues here we alluded to earlier, where people truly feel that they're growing up, the trauma they've experienced has so much added to what they're going through in mental health and how we can address these issues. Over to you, Dr. Tandiwe.
Thank you very much, Ali. And I think that Dr. Francisca Walia and Dr. John have ably touched on most of the issues surrounding that. Yes, so like earlier said by Dr. Francisca, yes, in individuals who have experienced childhood trauma, it could have been displacement, it could have been childhood neglect, it could have been maybe they were in a country which was war-torn at that time. At that particular point, you might not see anything. But if this was not addressed, there are certain, they might develop certain dysfunctions at certain stages in their lives. And so I think what becomes key is identifying at-risk individuals. Who are the individuals at risk? And so these are individuals who have experienced certain events, which we are referring to as major life events. The same ones, the divorce or the abuse, childhood abuse, those are individuals who are at risk. Someone who has experienced a bereavement is at risk. I might give you an example of what we saw, for example, recently in Zambia with the drought. We saw individuals having mental health issues stemming from the drought. You are a farmer, you have gotten a loan, you are a young farmer to buy farming inputs, and then it doesn't work because there's no rainfall. So that in itself, it is a climate issue, but it becomes a risk to this individual whose livelihood depends on, normal rainfall pattern. That is an example. I will also comment on the issue of the road traffic accidents. So I was privileged during my master's. That is what I worked on in terms of physical trauma survivors, road traffic accidents, sporting accidents. Most of the times, these are individuals who, when they come to the hospital, people deal with the physical injuries, but they have a psychological aspect that we need to address, and we need to identify them as at-risk individuals. So I think that's the key issue. Are we able to identify individuals who are at risk, and are we able to offer the necessary support before? Because this has been proved to be very helpful in preventing some of these major mental health disorders. I'll end here.
I appreciate that. Over to you, my co-host over there in the Big Apple in New York. If we can sort of roll and keep rolling. Over to you.
Yes, so I think what I wanted to ask is more on the youth advocates. Like Juanita just posted here that she's a youth advocate. I believe she's in university now. So how does she access resources to help her friends at school, for example? And how do parents who now know maybe that their child is suffering or they're going through some mental health issues, how do they access resources either at Chinama or in the community with nonprofit organizations? So what are the steps that they need to take for them to access information and resources?
Okay, so
okay, can go ahead, Dr. Tembo.
so depending on whether like you said, if she's in university, usually the universities, they tend to have, the student support services. They have some counseling centers or units within the institutions who are able to assist with that. And depending on how far they can go, they can assist, and if there's need, make referral to other organizations or healthcare facilities that would be able to come in. So in a university setting, that's what you want to start with. Student support services should be able to have some form of materials and should be able to offer some support to the students that need that support. When it comes to Chainama, I think I'll ask Dr. Francis Kawalia to talk about Chainama.
Maybe before Dr. Francis comes in, partner, I think there's a question here in relation to what you're discussing, if you can highlight that. I think it's a comment from the listener.
Yes, it says, only when speaking with my therapist did I start to come to terms with all the loss of loved ones and close friends to HIV/AIDS and death early in my childhood. I enjoyed this discussion and panel.
Thank you.
And shout out to Aliko.
Yeah. So just maybe adding to what Dr. Tembo has already mentioned. Indeed, most universities and schools, they do have either guidance counselors, counseling units, because these are some of the things that we've been encouraging institutes of education to have. But in addition to that, since she mentioned that she's an advocate, and if she's in school, we've been encouraging mental health communities or associations in schools, and we've managed to achieve a number of those in several schools. So if her university or school doesn't have one, it could be an opportunity for her to start one. And we tend to engage and have different activities where we engage various universities and higher learning of higher level of education, where we have debates, discussions around various mental health issues or various awareness activities within their universities and in community. And other than that, we do facilitate, take for example, there's an opportunity for a grant or a partner to do certain activities. If you are a registered civil society organization, I think that would be an important aspect to also do. Have your paperwork in place, because that also legitimizes your activity, and that way it's easy to refer you to support and for us to engage you or collaborate with you on various activities. Then other than that as well, there is a mental health community, and that mental health community comprises of a lot of youths that are doing different works in the country around mental health. So that as well could be an opportunity. She could reach out, you could share her contact with me, or you could share my contact with her, and we could link her up to those safe spaces. We're seeing a lot of youths doing great things, getting grants from various state agencies, working or collaborating with other NGOs that are established within the country and achieving great things. So there is a lot of input in that area. So it's good to hear that she's trying to do some work in this
Yes,
space.
and I think you met her as well at one of
Can
our
I just
events.
add one more resource?
Sure.
So I think my colleagues are down on the ground in Zambia have mentioned a number of wonderful resources that patients and people with health challenges can access. I think the message that we're putting across is that remember there is help. If you're struggling with anxiety, you're struggling with depression, you're struggling with insecurity, you're struggling with post-traumatic disorders, there is help that's available. You need to come out and seek support. Recovery may not take one day, but people recover from these conditions and begin to live normal lives. So the one resource I wanted to add is we live in a different world, as I said at some point during this discussion. There is also a lot of online resources that people can access. There are amazing, wonderful resources that people can access. I have reviewed some of these resources in my line of work that I'm recommending the right resources to patients. There are a lot of wonderful resources, honestly, and most of them are free. You can access them depending, because when you have a psychiatric issue, some conditions don't require medication. Some conditions require just counseling and therapy. Some conditions require medication, etc. But if it's a condition that requires just therapy, there are wonderful resources. The only caution that I would give to people is when you're looking for resources, I know online you can find anything. Anyone in a bedroom somewhere in Japan or in Swaziland can post anything, and that's not the type of resources I'm talking about. If you're looking for resources, make sure you're looking for reputable organization. You can look at University of Oxford or Washington University or University of Toronto or San Francisco General Hospital, if there's anything like any such organization. Look at the reputable organization and look at their self-help resources that they have, even professional organizations like Royal College of Psychiatrists in the UK, College of Physicians and Surgeons of Ontario, etc. These organizations have pages packed with resources for people to access and use a treatment called cognitive behavioral therapy, which can be expensive to access, but they are wonderful resources that you can find online. So don't forget that you have this resource that you can access in addition to the local resources that may be available to you.
And you can also call a friend, because I always say friends are free therapy.
Yes, indeed.
Absolutely.
And allow me to also just mention something very important when it comes to where can one get help. I know there's this notion like maybe only in the private sector can you receive mental health support, and yeah, it could be a bit more costly than in the public sector. But I would like to encourage the viewers, especially those in Zambia, that you can get mental health support at any health facility near you. Just walk to any health facility near you, just like the way you walk to a health facility for a headache, for a cut, a wound. You can also walk to any health facility near you for a mental health issue. And if there's need for you to get further specialized input, you'll be referred, just like the way we refer for any other medical condition. Thank you.
Thank you so much. Just a comment from one of our viewers. For people in America, most of your companies have what is called EAP, which is a confidential work-based program that provides free or low-cost support services to employees and, in many cases, their family members to help them address personal and work-related issues. Thank you for that, Mulenga. All right, we're almost.
Let me just come in on Mulenga's comment. The EAP should not only be companies, it should be part of policy. I know in South Africa, for example, that the government itself, all government employees and the facilities have got EAP, Employee Assistance Program, which they must do a mandatory, as well as the wellness kind of day. They should have a wellness day. So when we talk about policy, it's about implementing some of these things, that if it's led from the top, then it will be easier for people on the ground to implement this. So that's a very good comment. Thank you.
Thank you very much for that. We only have a few minutes, so we're going to ask our speakers just to give us your final comments before we close out. And I'll start with you, Dr. Tandiwe. Any final comments?
Thank you very much, Yareka. It has been very wonderful being on the program. And I think what I would like to say to our listeners out there is that there is help. Help is there. Help is available. And help starts from right within us, starting from our families to our communities. And when we're talking about community, it includes our religious organizations all the way to our healthcare facilities. Help is available. And I must say that it is important to take note that adolescents and youths do also have challenges just like adults do. Sometimes there's a notion that maybe they do not have as many challenges, but in essence, they are going through stages in their lives that have so many issues going on, and so they tend to face challenges. Let us be a brother's keeper, a sister's keeper. Let us look out for at-risk individuals. And if we are not able to help them, let us point them in the right direction. Help is available. Thank you.
Excellent. Yep.
Thank you for that, Dr. Francisca.
Thank you. I think for me, I'll say, let us be part of the change. All of us have a role to play. It starts in the community. It starts in the home. Let's take care of ourselves. Let's look out for the loved ones and the people around us. Let us go back to the rich culture aspect of Ubuntu and community that we have. And I know that can look different right now. It might not be always a physical meeting. Nowadays, we can take advantage of technology, just like we are doing right now. We can spend time, talk to friends who are across, abroad, meet up with friends, be deliberate to prioritize your well-being. And I think another interesting thing that I think I've just appreciated on this platform today during the ads or the break, to just see that there are actually so many organizations in the diaspora doing so many different things. And for me, I think a major take home as well is I'm looking forward to networking with Professor here on the platform and seeing how you, our fellow Zambians in the diaspora, can help us with some of these challenges that we're facing, how we can put our resources together to come up with solutions. Yeah, I'm looking forward to that as well. Thank you.
Thank you, Dr. Francisca. Dr. Ngogu?
Yeah. Thank you very much. I very much welcome that, Dr. Francisca. And I did think about, because I didn't know, I don't know psychiatrists in Zambia, so it's wonderful to be on the same platform and forum. And I think we should definitely link up and do some work together. That would be amazing. But in terms of my concluding remarks, what I wanted to say is, I mean, we've all heard this term, prevention is better than cure. So that's going back to what I talked about earlier on, that young people, I think you should invest in your own health, your mental health, by doing positive things. Some of the things that I articulated earlier on in this discussion, you have something in your hand that is a powerful instrument that can bring you powerful and amazing rewards. But at the same time, that powerful instrument in your hand can take you the other way. It just depends on what you decide to do with your cell phone. So, there are many resources that are available online that you can you can dive into that will help you to plan your life, to manage your anxiety, to get the support. So listen to self-help podcasts, watch some self-help videos, invest in your mental health, and don't wait for that day when everything has collapsed and you're struggling big time. Begin to do these positive things that will help you on a rainy day. That's the message I'd like to give the young people. Begin to invest, surround yourself. We've heard the term from Dr. Francisca a number of times of Ubuntu. You don't know how fortunate you are to live in a community like ours. I mean, I left Zambia more than 25 years ago, but I go there every time. I was there in 2023, 2024. I'm coming back again this August. And the sense of community that you have in Africa is very different. Tap into that sense of community. If you are having something that's bugging you, talk to somebody, seek help, get the support that you need, and you find that you are in a better place than suffering and struggling in private. But just go out there and seek support. We've heard a number of times during this forum that help is available. You just have to be open about. There's no shame, and I think that's one thing we should be doing, which I wanted to mention, but I forgot. One thing is bring out people. They do that a lot here in the West, where you find people who have struggled at some point in their lives with a mental health concern. They've overcome that and they're doing really, really well. So we need to get these people out and about and on our forums to speak to their lived experience so that people can see them and learn that, you know what, he passed through so many things, but look at how successful this person is. So I think having people with lived experiences help us to spread the word and to provide this education that is very, very important in taking care of the mental health, especially for our young people. Yeah.
Absolutely, and thank you for that. And before I ask Dr. John and Ali to close us out, I just wanted to mention if, or rather to ask if we have a central database where these resources are. And if we don't, maybe this is something that these young advocates can build as part of a project in their schools and work with the Chinama and other institutions to build something that all Zambians can access and to know where to get help. So over to you, Ali, and then Dr. John will close us out.
Thank you, Yereka. This has been a phenomenal show. Brilliant minds here, and you can almost see that definitely there's work that needs to be done in the space of mental health and supporting our different communities where we are, whether it's in the diaspora or in Zambia. But uh, one of the things I would like maybe Dr. John, as he closes off this, is to highlight. He did talk about policy to highlight some of the intersection and truly what Gazhp is doing here, and how can we make Gazhp as a launching pad to this discussion in terms of bringing this awareness to the listeners, and also to specifically to the Zambian audience on the ground, people that are going through this, and some of the great things that Gazhp is doing here. Dr. John, please take us through.
Yeah, thank you so much, Ali. And I think I would do actually first try to thank the participants for attending, those who are listening in to the program, as well as the ones in the studio, Dr. Francisca, Dr. Tandiwe, Prof. Jedrin Ngungu, yourself, Ali, and Yareka for a tireless energy, effort to put this together. And obviously, not to forget the Zambia Block Radio, Nathan Nkata, who's been so helpful in all this. And I think as Gazhp, we've got flagships, for this year, and we thought that this year we'll be looking at mental health. And this was our first session. We are going to have more sessions, hopefully, to try and build up for what we are doing. But at the same time, we've got programs and trying to make effort on the ground that we work together with the Chinama Mental Hospital there, as well as the other stakeholders in terms of mental health, particularly for now. And we are also wanting to ensure that we open a chapter in Zambia, the Gazhp chapter, so that in terms of communication, we could do better and quicker. We were very impressed with the way you responded. You responded to assist us and to come on board very quickly. And that's the kind of spirit that we are trying to fight for and get on the ground. We've come a long way, about 5 years since we registered, and we've had successes on the way. I think time is not on our side for us to try and go into those successes, but we are trying very hard to maintain that and even do it better. We projected a website there which we need to share. It's not fully functional, but it's something which you can visit, and as we improve on it, you'll be able to get much more information and our calendar and so on. Yeah, so I think I will end there for the sake of time. It's Nathan in coma. Sorry, I think I made a
Nkama.
Nkama, not in coma. Nkama. Yeah, thank you. Not in kata, not in coma.
They all sound the same.
Yeah, thank you. No, it's in Nkama. Thank you so much, Nathan, and we will meet again very shortly. Let's see how we can also help this radio program to continue delivering excellent results. Thank you so much. We can end it here. Thank you.
All right. Thank you again. And to my co-host on the East Coast, I'm on the West Coast, is Kumbaya.
Thank you
meeting
so
in the
much.
background.
Thank you, everybody, for your
Thank you.
time.
Thank
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 you
you
for our
so much.
audience.
Thank you.
Thank
Bye-bye.
you.
Hello, Zambian diaspora businesses. Do you want to connect with your community back home, right on ZBTR TV? I'm here from Vibeforge AI Studios, Tilfeus, where we're crafting faith-fused media with AI magic. From AI music video production to powerful AI image creation and even music composition. We've got everything you need to make your advertising truly resonate on ZBTR TV. If you're ready to make an impact, let's create something extraordinary together. Your vision, AI powered. Connect with Vibeforge AI Studios today.
Zambia Blog Talk Radio.